All right, Mike, tell us or describe what type of pain or injury that you were dealing with and how long you had it.
Yeah, so initially I started to notice symptoms of neck and shoulder pain, specifically that like kind of radicular pinched nerve feeling in the back of my neck. And then I found out there was, some relation to that in my shoulder blade, and I have TMJ issues. And so I think, hearing that Chad was someone who was particularly familiar with and specialized in those types of areas and managing the pain from it, I thought would be beneficial to come in and see what was going on.
What did you try in the past that didn't work specifically for you, Mike?
Well, I've done multiple courses of physical therapy. I didn't mention that my neck and shoulder issues have been going on for a couple of years now. I'd say about two to 2.5 years. It's just been one physical therapy visit after another, or seeing the TMJ doctor and they're giving you an orthotic, and it's just you start spending so much time and money, but it's still frustrating when those courses don't really hold up. So I was looking for something a little bit different, and I liked that Chad had some specialties in treating those types of symptoms. And I'd say the number one thing that I like is that it's the one-on-one experience that you get, that I'm not it's not somebody who's sitting there typing something up at their cart and then just going on to see the next patient and going from patient to patient while you're sitting there doing stuff for all in bad form and no one's watching you. So that's what I think is the biggest difference that I really see between other physical therapists and Chad.
What was your number one goal coming in here, Mike, and did we help you to achieve that?
Yeah, really to get some more functionality, and just, being a little bit, just not having days where I would just sit there and be in miserable, amounts of pain all day. I think I've gotten a lot of that back now, where I can go through the day now and go to work, and, for the most part, I'm in a lot better shape than I remember days back in the past. It was, I really didn't want to leave the house at times because it just was so painful, and I'd go out with family and they'd sit there and, I just looked like miserable, and stiff, and everybody always would ask what was wrong. So I've noticed a lot of that has subsided.
During your time here, Mike, what did you enjoy the most and why?
Well, as I said, I like the one-on-one experience. I like the fact that like I said, it's not multiple patients here. It's not some big facility. It's just, everything that I'm doing, is based on Chad's custom plan that he, comes up with. And, he's right there to observe everything. Again, I always wondered if I was using decent form or not at other places, and never really got good feedback about that. But I like that Chad's standing right there to show me things that I might be doing wrong or corrections I can make.
Now that you've had the experience at our clinic, what would be your recommendation for others dealing with something similar to yours when they're looking for treatment or a resolution of their symptoms?
I know I personally, look for a personalized experience as much as possible. I think there's way too many medical practitioners in this day and age who just kind of runs you through the system and runs you through a generic program, and they're just checking boxes and signing off. And again, I had not really had much relief with those types of things in the past. I would buy books that had stretches and things like that in there, but I don't think there's really any true substitute for coming in and actually doing that with somebody in a guided fashion like I've done here. And again, it's, if something isn't working, or if I don't like the way that something is going on, it's easy as just, Chad's a foot away from me at any given time, and I can just talk to him about it. It's not that I have to sit and wonder what they're actually doing or what they're supposed to accomplish. It's nice to know that there's those types of defined goals, and I think having the assistance in that, and encouraging you and telling you what you're doing right and wrong is very beneficial, and I think crucial.